Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thank you for tuning in to the latest edition of The Checkup. Even as the coronavirus pandemic continues to grip the nation, that hasn't stopped a pretty sizable move in the industry, and that's the continued growth and innovation of new primary care models, led by such companies as Oak Street Health, ChenMed, and VillageMD. In fact, in July, Walgreens announced that it was investing $1 billion in VillageMD to partner with them to open between 500 and 700 clinics nationwide over the next 5 years. I'm pleased to be joined today by Tim Barry. He's co-founder and CEO of Chicago-based VillageMD to talk about how these new models of care are disrupting the industry. Tim, thank you so much for being with us today.
Matt, thank you for having me. Thrilled to be here.
And so before we delve into the new models of care that you and other folks are disrupting the industry with, I did want to check in with you. Prior to us coming on air, you were talking about how you actually had COVID in mid-November. Wanted to see how you're doing and how you're feeling now.
Yeah, thank you for asking. I'm definitely feeling better now, but not going to lie, it was a rough couple of weeks. The symptoms that you often read about as it relates to COVID, I can attest to having just about every one of them, and I feel very blessed as compared to where a lot of people, experienced it worse. But it's not something that I would want anyone to have.
Well, good. Yeah, certainly not. We're glad to hear you're feeling better. And help put it in perspective for us. You're the first guest on the checkup to have had COVID. You run a primary care model. How does that influence what you think about now as you think about the organization going forward?
Yeah, no, thank you. It's pretty interesting, Matt, because the one thing that I would say is all guidelines around mask wearing and washing of hands, people should take it pretty seriously. Second is that it really highlighted for me the incredible need we have in the U.S. healthcare system to really extend the type of care that we provide beyond the clinic setting. And really being able to meet the needs of patients whenever they have those needs, right? So thankfully at Village, we have a team of people who are 100% focused on being a COVID task force. And so all of our patients that test positive, unfortunately, we have this COVID task force be on a regular cycle with them and engaging them and working with them throughout the course of their disease. And we found that to be incredibly successful, and have seen a very small number of patients who in fact have to go to the ER or get admitted because of this added touch, right? And so what it does for me is it really reinforces that primary care, while it has existed for decades in this country, largely as an outpatient only or ambulatory only setting, primary care does need to change, and primary care needs to be 24/7. It needs to be available to patients, not just in a clinic, but when the patients are in the home, accessible via telehealth, as well as using other technologies to really extend the kind of care you can provide to patients.
Right. So the change in primary care, some of those things are ideas that your co-founder, Chief Medical Officer, Dr. Clive Fields, wrote about in Modern Healthcare in a commentary over the summer, talking about how the pandemic really exposed some gaps in primary care. So, as we think about, that was in the summer, as we think about where we are in November, have you seen the industry try and government try to respond to closing some of those gaps? And if not, where do we need to go?
Yeah, I think, as American citizens, we should all feel pretty good about some of the adoption that has happened in the healthcare system. So, primary care providers, even the smallest practices who did not have a lot of technology, in order for them to survive, they in fact had to adopt technology, especially telehealth, in ways that allowed them to see their patients. The most encouraging advancements from a technology standpoint in primary care have really been around using telehealth, not just to be accessible to a patient because they have a sore throat or they have some kind of ear infection, but the more advanced primary care providers like VillageMD, we're now incorporating telehealth into every one of the treatment plans that we have for all of our patients. And so if you're a diabetic patient, not only do we want to see you in the clinic, but we're now seeing you in the home. We're leveraging group diabetic education online. We're also making available our nurses, our social workers, and pharmacists all via telehealth, so that you really have this whole care team of people that, while they may not live with you, they're all within, frankly, within a minute's reach. And so it's pretty exciting to see that. On the governmental front, you mentioned that, Matt. I've just been incredibly encouraged by the fact that CMS has continued to push forward the direct contracting program for Medicare, which is a program that has the federal government, CMS, contracting directly with provider organizations and allowing us to work in a capitated environment, so a prospective payment model, so that the energy that we put into running our business is we're not worrying about where the dollars are going to flow in order to provide the best care for patients. We're just going to do the right thing for patients. And so I've been really encouraged, not just by the government continuing to push it, but also by other organizations in the industry who've raised their hand to say, you know what, we have a moral obligation to do the right thing for patients. COVID has shined the light on the fact that a fee-for-service healthcare system is a broken system. And there's lots of organizations like ours who are jumping in to say, let's be a part of the future and the capitated models.
Right. Well, so let's pivot now. That's a good pivot point to talking about how VillageMD and some others are disrupting the industry. But let's go back to that Walgreens announcement from July. Sure. Tell me a little bit about how that rollout's going. I know you've had some news earlier in the fall about the rollout in Atlanta, I believe, of several clinics you're opening there. But give us an update of where you are.
Yeah, so the rollout with Walgreens is going incredibly well, frankly. We had the benefit, Matt, of several months of preparation for this, and so it was in the fall of 2019 when we launched the first 5 pilot clinics with Walgreens, and those have continued to be just a great success, and success measured by net promoter scores from patients that are in the 90s, success measured by more patients who have chronic disease that are taking their medications, and higher quality of care that's associated with that, so that patients who are hypertensive, patients who are diabetic, patients who have high cholesterol are being more adherent to their clinical treatment plans as a result of this integration between primary care and pharmacy. So, we were not surprised by the fact that these clinics continue to roll out quite successfully. The level of enthusiasm that we have from doctors has really been spectacular, and I'm really not surprised, because I think in the history of healthcare, when we present data and information to the scientific and altruistic mind and heart of a doctor, and that data shows that by better integrating primary care and pharmacy in a more convenient location, and doing it through a state-of-the-art design and in a state-of-the-art technology-driven clinic, you're going to have doctors who want to practice in those settings. And so, we're thrilled to be announcing, the next dozen that are going live literally as we speak today, and dozens more that are right behind it.
So as you think about what you're doing, I said at the outset, Oak Street Health, Chen Med, Optum even is getting into this arena as well. What does it say about the industry that we're seeing a lot of, especially private equity backed organizations coming in and trying to kind of blow up the primary care model? What does it say about where the industry is and where it needs to go?
Yeah, it's funny, Matt. I don't think any one of us is sitting here waking up saying, hey, we've got to blow up the primary care model. Every one of us is looking at what's happening in the U.S. healthcare system and saying, there's a better model. There's a better way to deliver healthcare to the citizens of this country. And we're hell bent on making sure that we do that. So when you look at the results of VillageMD, you look at the results of an Oak Street Health, what you're going to find consistently is that it's the top level healthcare that you're going to find in this country. And so, there's this sort of magical, mythical brand of the academic medical centers. But the reality is that for caring for the general population, it's organizations like ours who are proving quantifiably that we can deliver better healthcare. And it's across the Medicare population, it's across the employer-sponsored or commercial populations, it's across the Medicaid populations that we're showing market by market, doctor by doctor, that the care that is being provided can be better. And so I think that the exciting thing from our lens is that we believe is that the more that the federal government, through a direct contracting model, the more insurers are recognizing the power of these models and trying to put more dollars and support behind it, I think it's going to force the rest of the industry to ultimately get better as well. And so, our at the end of the day, we run VillageMD. I don't run any other organization and don't profess to, but if our success and our results force the rest of the industry that's working in a nonprofit model that far too often is hospital-based, where they're incentivized for more hospitalizations, as opposed to saying, hey, maybe we don't need all these hospitalizations. Maybe if we provided better care in the primary care setting, we wouldn't need to have so many ER visits. We wouldn't need to have so many surgeries. If our impact in the industry is that it improves everybody else's, that's a good thing for everybody.
Yeah, it's interesting. You referenced the capitation model. It's hard to find, right, a silver lining in COVID. But one of the things that so many people are talking about is maybe it's finally that real accelerator we need to move towards global payments or capitated payments, value-based payments, whatever you want to call it. Are you sensing that people are beginning to realize that this is sort of that last push we needed to get there?
So Matt, I will tell you, I'm a pretty optimistic guy, but I'm not yet convinced the rest of the industry is there, right? I think, sadly, I think the rest of the industry probably needs to experience a little bit more pain before that time actually happens. So I know far too many hospital organizations who have been developing strategies to quote unquote gin up demand or incentivize demand, words that should never be spoken, frankly, in the healthcare system, as opposed to how do we provide the best care we possibly can for all of our patients. And so, that should be the goal of the healthcare system. And so, I am encouraged, frankly, that the government held fast and introduced the direct contracting program. I think that there are some early adopters who will, see the kind of success that a VillageMD or an Oak Street Health has and say, yes, we should be doing more of that. And if they can be successful in capitation, then why can't we? But frankly, I think they're going to need a bigger push in order to get the kind of religion that's needed to ultimately get to a spot where everyone in the healthcare system is working in a fixed payment type model.
Interesting. Well, we'll see how that unfolds. Last couple of things here in the last couple.
I really do hope I'm wrong.
Yeah. Well, last couple of questions in a couple minutes we have left. We sit here late November. In mid-November, Amazon announced its online pharmacy. You've got a relationship with Walgreens. How might the Amazon announcement disrupt what you're trying to disrupt?
Yeah, so I think everyone in the industry has been waiting for that type of announcement from Amazon. And so, we've been watching, frankly, lots of technologies over the span of the years that have continued to fragment the healthcare system. And so, I'd love to tell you that I thought it was the greatest thing in the world. But because, and at the end of the day, the reason why I say that is because, our focus is on taking care of people who have chronic disease, right? We ultimately want to treat them the best we can, and we want to swim upstream to ultimately prevent more people from getting chronic disease. That's what we do in an at-risk and value-based primary care model. And so with that said, people accessing medications because they're going to save an extra dollar by getting it through Amazon, I can see that. I can appreciate that as a customer, as a consumer. But that may not lead to the best overall care, because that medication that they might buy on Amazon might be contraindicated with the other 7 medications that patient's on. And so we've got to think about what are the goals of the system. And so, I'm not surprised by Amazon. Good for them. they can continue to fragment the industry if they think that that's a good thing. Our focus is on the best outcomes for our patients. And what we know are the best outcomes are when the primary care doctor and the pharmacist are working hand in glove to make sure the patient's getting all the medications that they need. They're getting them in an affordable basis. They know when to take them. They know how to take them. They know if there's any other issues associated with when they take them, so that we're keeping people healthy, and we're keeping them, frankly, out of the emergency room, out of the hospital, where the biggest amount of savings are in the healthcare system.
Yeah, interesting. Great, because the last thing the industry really needs is further fragmentation.
Exactly.
From a patient perspective. Lastly, Tim, in the last minute we've got here, private equity, venture capital is growing in its reach into the industry. You've got some venture capital backing. I don't want to really talk about, pluses and minuses of venture capital. We've done that elsewhere in this program. But I know you've talked about just the kind of data that you as a organization need to share back with those investors. What's that like, and what kind of data are they looking for to make sure that they're getting return on their investment and also that patient care is improving?
Yeah. So the thing about, I'm sure not all private equity is going to be identical. For us, the people that we chose as our private equity partners, we wanted to make sure that these people were in it for the right reason. That they were in it for the same reason that we are, which is how do we ultimately deliver on the promise of a better healthcare system quantifiably, and that they understand that it takes a while to get there, right? So, first and foremost, the sponsors that we have with Oak HCFT, Annie Lamont, or whether it's Shinovik and Chris Bischoff, or Town Hall Ventures and Andy Slavitt. We are incredibly blessed to have some great forward-thinking healthcare leaders as in our stable. In terms of the kind of information, Matt, that we provide to them, it always starts with the quality of care. That at the end of the day, we are showing, and we prominently display that, here's the patients that we have. Here's what the quality of care used to look like before these doctors started working with VillageMD, and here's where the quality of care is now. And thankfully, that number continues to improve every market, every year, every population. So we start with quality, and then from there, by working in a risk environment, we show them data around the number of emergency room visits, the number of hospitalizations, the number of readmissions, all things that are proxies for good quality care. That if you're seeing your patients frequently enough and you're getting the right clinical outcomes, they're going to in fact need to use the healthcare system less. And that's where we drive savings, right? And that's ultimately what drives profits for our company. So, thankfully, we're fortunate to be able to be in a model that says that the way that we drive profits is by showing quantifiably we deliver better healthcare. And so, we start with the quality of data with our private equity investors from the get-go, and they understand that about our business, and thrilled to be a part of a company that can actually make money while doing the right thing.
Yeah. Well, Tim, we appreciate that insight and all the insights you've delivered during this interview. So thank you so much for taking time. We'd love to keep checking back in with you. You're doing a ton of stuff, innovative stuff at VillageMD, so we'd certainly like to check back in with you over time.
Always a pleasure to see you, Matt. Thank you.
Thanks, and glad to hear you're on the mend, and please stay safe.
Yeah, thank you. Really appreciate it.
Thanks so much. Okay.
Bye.
And I'm Matthew Weinstock with Modern Healthcare. Thanks for tuning in to The Checkup. Be sure to come back next Monday for another interview segment. Thank you.